Welcome to Pharmacy Prep, PTCB, Pharmacy Technician Certification Board, and Pharmacy Technician Certification Exam. Tricky questions. These questions helps you to prepare and pass your Pharmacy Technician Certification Board exams. Let's start. A physician prescribes Provera, which is medroxyprogesterone 5 milligram tablet, to be taken once daily from day 16 to day 25 of each menstrual cycle for 3 months. How many tablets should be dispensed? A. 30 tablets. B. 45 tablets. C. 90 tablets. And D. 120 tablets. So pause the video and guess or calculate your answer. The correct answer is 30 tablets. Let's see how do we get 30 tablets. So if you look at this step-by-step reasoning, the question asks for days 16 to 25. That is means 10 days of therapy per month. Here it says 16 to duration 3 months. So therefore 10 days per month and 10 for 3 months, that would be 30 tablets in total. Next, how many grams of drug is required to prepare 100 ml of 1 to 15 solution? A. 5 grams. B. 6.6 grams. C. 7.5 grams. And D. 15 grams. Correct answer is 6.6 grams. So first here, the question says ratio strength 1 to 15, which means 1 gram drug in 15 milliliters of solutions. So now, question asked for 100 mils is how many grams? So you can do simple cross multiplication. 15 mils in 1 gram in 15 mils. So for 100 mils, how many grams? So point the arrow to the x and then do the cross multiply. So that means 100 mils into 1 gram divided by 15 mils. So if you do cross multiply, you get 6.6 grams. So correct answer for this is 6.6 grams. Next, a technician fills a prescription for 10 milligram when prescriber wrote 1 milligram. What caused this error? A. Clear decimal placement. B. Trailing zero misinterpretation. C. Wrong patient name. D. Incorrect units used. The correct answer is trailing zero. So placing 1.0 can result into the errors. So therefore, it is recommended to avoid trailing zeros. Instead of writing 1.0, you can say just 1 to avoid misleading to 10 milligram. Next, what is the national drug code? A. 10-digit code used to identify drug products. 5-digit code indicating manufacture of a drug. C. 3-digit code representing therapeutic class of drug. D. 7-digit code specifying expiration date of a drug. Correct answer is a NDC is a unique 10-digit code that is used for identifying drug products. So here NDC has 10 digits. Among them, first 4 digits are labelers. Labelers refers to manufacturer of the product, like who's the manufacturer, and other 4 digits refers to specific drug name, such as here in this case Prozac, and also it shows the strength and dosage form that comes as a capsule. And final two digits here are refers to the amount in the package, that is 100 tablets, 100 capsules. What DEA schedule is assigned to hydrocodone acetaminophen? Brand name is Narco. DEA Schedule 1, Schedule 2, C Schedule 3, and Schedule 4. Correct answer is Schedule 2. Obviously, Schedule 1 does not have any prescription drugs, whereas Schedule 2 consists of opiates with such as hydrocodone plus acetaminophen, whereas Schedule 3 has acetaminophen with codeine and anabolic steroids. Schedule 4 are benzodiazepines such as lorazepam or Ambien. Those medications include in Schedule 4. Next, a John Smith is a physician with a DEA number of AS1234563. In this DEA number, the letter S indicates A. Registration type such as physician, B. First letter of prescriber last name, C. First letter of prescriber first name. All DEA numbers with A is the first letter. The correct answer is the first letter of prescriber last name. So here this is the DEA code. In that one, this letter S here is the first letter of the prescriber's last name, whereas this letter indicates the physician registrant A. And other numbers such as 1 to 6 here are unique identifier digits, whereas number 3 here is checksum digits. Next, a child weighing 33 pounds prescribe amoxicillin at dose of 50 milligram per kilogram per day and divided dose every 8 hours. So calculate dose per administration or per dose. A 750 milligram, B 500 milligram, C 250 milligram, and D 50 milligram. The correct answer is 250 milligram per dose. So here let's calculate. Basically, this calculation is for dose calculation based on body weight. The first step in the calculation, convert pounds to kilogram. To convert pounds to kilogram, just divide by 2.2. So 33 pounds divided by 2.2 gives you the 15 kilogram. And now calculate the total daily dose based on the body weight. So to calculate dose in milligram per kilogram multiplied by body weight in kilograms. So in this case, it comes to be dose is 50 milligram per kilogram. So body weight is 15 kilogram. So it gives you 750 milligram per day. However, this is a daily dose, but the question has been asked for per dose, each dose, how much. So if you divide, so here patient prescription says take it every 8 hours. That means 3 times a day. So therefore 750 milligram divided by 3, that gives you 250 milligram per dose. Next, within how many business days must this theft of controlled substances reported to the DEA field division office? A 1 day, B 3 days, C 1 week, and D 14 days. Correct answer is 3 days. Although theft and loss of controlled substances should be reported within 1 business day as a written notification, but the DEA Form 106 that is used for reporting theft or loss must be submitted within 3 days, business days. So many exam sources accept 3 days as a correct reporting period. Next, a patient is prescribed to apply 5 grams of topical cream twice daily. The prescription is for 100 grams tube. Calculate the day supply. Mean if you apply this 5 grams a day, twice daily, how long this 100 grams of tube will last? A. 10 days. B. 20 days. C. 25 days. And D. 30 days. So correct answer is 10 days. So let's calculate this one. So first determine total quantity taken per day. So you're applying 5 grams daily and then twice a day. So that gives you daily per day is 10 grams a day. The second step, calculate the day supply. The formula for calculating day supply is total quantity dispensed divided by quantity taken per day. So if you do that here, total quantity is 100 gram tube. Daily you're taking 10 grams per day, so it gives for 10 days supply. Next, how many clindamycin 150 milligram capsules are needed to compound 150 ml of 100 milligram per 5 ml liquid? A. 50 capsules, B. 25 capsules, C. 20 capsules, and D. 10 capsules. Correct answer is 20 capsules. Let's see how do we get 20. First, total milligrams needed. Find the total milligrams needed. That is 5 mils contain 100 milligrams. So for 150 mils, how many milligrams? So do the cross multiply. To cross multiply, point the arrow to the x milligram always, and then another arrow to the 100 milligram. So if you do this cross multiply, it comes to be the total milligrams of clindamycin needed here for this prescription is 3000 milligram. So now each capsule is 150 milligram. So 3000 divided by 150, that gives you 20 capsules. Next, what is the sales price, also known as retail price, of a prescription drug with a cost or average wholesale price is $19.50. A markup of 8%, a dispensing fee is $9.50. A. 1950, $19.50. B. $30.56. C. $9.50. And D. $1.56. Correct answer is $30.56. Let's calculate. The formula for calculating retail price is cost plus cost multiplied with markup plus dispensing fees. So here the cost is $19.50. The markup is 8%, that is equals to 0.08 as a decimal, and dispensing fee is $9.50. So first calculate the markup. The markup is cost into uh, 8%. So that would be equals to $1.56. So next you add all the three, such as $19.50 cost, markup is $1.56, and then prescription fee is $9.50. So total gives you $30.56. Next, what is the direction for the following SIG codes? 4GTTS PO every 12 hours UD. A. Give 4 drops orally every 12 hours as directed. Give 4 drops orally every 12 hours as needed. C. Give 2 tablespoonfuls orally every 12 hours as directed. And D. Give 1 teaspoonful orally every 12 hours as directed. The correct answer is A. So here GTT stands for drops, PO by mouth every 12 hours, and UD for as directed. Next, a physician asks pharmacists to compound codeine sulfate tablet triturates containing 10 milligram of codeine. The patient needs 5 days supply and may take every 1 to 2, every 4 to 6 PRN. And this is what you have to focus here. How much codeine is needed to fill this prescription? A, 300 milligram, B, 400 milligram, C, 600 milligram, and D, 1200 milligram. Correct answer is 600 milligram. Let's see how we get that. So 600 milligram means here question was 1 to 2 every 4 hours, 4 to 6 hours. So when you have a PRN, PRN means as needed. So in this case, you take the maximum frequency, that is 2 times, and also take like maximum number of tablet, 2 tablets, and take maximum frequency every 4 hours. So if you do that, 2 tablets every 4 hours in a day, 12 tablets per day. So now for 5 days, 12 into 5, 60 tablet. Each tablet is 10 milligram. So that gives you total 600 milligram. So therefore, your total answer is 600 milligram. Next, 1 liter of IV bag fluid is being infused. The rate of flow of IV is 100 drops per minute using drop factor of 10 drops per ml. How many hours are required to infuse the liter? A, 1 hour, B, 1 hour 30 minutes, C, 1 hour 40 minutes, D, 2 hours 30 minutes. Correct answer is 1 hour 40 minutes. So here flow rate formula is volume of IV divided by time to infuse and multiply by drift factor. It is important to memorize this formula. Flow rate here is 1000 mils volume. So drops per minute were 100 drops and drop factor was 10 drop per minute. So if you divide this 100 and two zeros, so drops gone, and then you have it two zeros, and then mils per mils, and then remaining is you have 10 into 10, 100 drops per minute. So next on that 100 minutes would be equals to 1 hour 40 minutes. So divide this 100 by 60, that gives you hours per minute. Next, which federal law defined two specific medication categories as prescription and over the counter? A. Food and Drug Cosmetic Act, B. Durham-Humphrey Amendment, C. Kiefer-Harris Amendment, D. Omnibus Budget Reconciliation Act. Correct one is the Durham-Humphrey Amendment. Durham-Humphrey Amendment distinguished between prescription and over-the-counter drugs. A vial of antibiotic ceftriaxone is supplied as a powder. The label indicates adding 10 ml sterile water yield concentration 100 milligram per ml. So the patient needs 250 milligram of dose. Calculate volume needed for acquired dose. A. After reconstitution with sterile water, draw 2 ml. Next, B. Draw up to 2.5 ml solution. C. Draw up to 10 ml solution. And D. Draw up to 5 ml solution. Correct answer is draw 2.5 ml solution to after reconstitution. So let's see how do we get that one. So the question is asking about volume needed. So here the formula for volume needed is a desired dose divided by concentration. So here you have a 200 milligram, 250 milligram is a desired dose, and available concentration is 100 milligram per ml. So that gives you 2.5 mils. So therefore you have to draw 2.5 ml solution after reconstitution that provides 250 milligram of the dose. Next, which book contains therapeutic equivalence scores to determine if a drug generic product can be substituted with brand name? A. Purple book, B. Orange book, C. Red book, and D. Green book. Correct answer is Orange book. Orange book provides therapeutic equivalence scores which indicates generic drug can be substituted for brand name. Codes start with A, like AAB. AA means products are equivalent. Whereas purple book contain biologic products, whereas red book focus on the drug pricing, green book lists the animal drugs. Next, a patient is prescribed 10 ml of antibiotic suspension to be taken 3 times a day. Prescription is for 300 ml of bottle. Calculate the day supply. A 10 days, B 20 days, C 30 days, and D 40 days. Correct answer is 10 days. So here first step is determine quantity be taken per day. So for day is 10 mils 3 times a day, 30 mils per day. So calculate the day supply. Formula for day supply is total quantity dispensed divided by quantity taken per day. So if you divide that, 300 mils is the total dispensed and per day is 30 mils. So this medication lasts for 10 days. Next, what is the day's supply for this prescription? Timolol 0.25% solution, 1 GTT OU twice a day, 5 mils. 5 days, 10 days, C 15 days, and D 25 days. Correct answer is 25 days. So let's see. So direction says 2 drops twice a day. That means 4 drops. By default, you have to memorize this. 1 mil equals 20 drops. That is for reference. If not specified, then you should take by default 1 mil contain 20 drops. So here 5 mils is solution and that is 100 drops. So total amount dispensed is 100 drops. So therefore 4 drops per day. So patient use this medication for 25 days. Next, a prescription was received for hydrocortisone 2.5% in petrolatum base for 60 grams. Quantity is 60 grams. M for mite or quantity. How many grams of hydrocortisone petrolatum required to prepare 60 grams of ointment? A. Hydrocortisone 2.5 grams, petrolatum 57.5 grams. B. 1.5 grams of powder, petrolatum 58.5. C. 2.5 grams of powder and petrolatum 60 grams. And D is 1.6 grams and 60 grams. Correct answer is 1.5 grams of hydrocortisone powder and 58.5 grams of petrolatum. So let's see how do we calculate it. So first you calculate 2.5% means 2.5 grams per 100 grams. So that means 100 grams has a 2.5 grams. So for 60 grams is x grams. So point your arrow to the x and then cross multiply. So it gives you hydrocortisone 1.5 grams. So you need a hydrocortisone 1.5 grams. So then petrolatum base supposed to be total like a weight by weight here. So subtract 60 gram minus 1.5 grams. So base is 58.5 grams. Next, the USB chapter that deals with the compounding sterile preparations. Chapter 795, B 797, Chapter 800, Chapter 2100. Correct answer is Chapter 797. USB Chapter 797 deals with sterile preparation, compounding, whereas 795 for non sterile compounding, 800 for hazardous drugs. What is the key strategy in community pharmacy to prevent dispensing errors? A. Use similar sounding bins. B. Skip verification or refills. Use barcode scanning and final check. D. Avoid Talman letter. Correct answer is barcode scanning and final check. That helps to verification helps to critical to avoid wrong drug errors. Next, the OSHA regulation address which of the following potential hazards in pharmacy. A. exposure to hazardous drugs like chemicals, latex allergy, and also PPE, availability of personal protective equipment. B. Strategies to minimize the dispensing error caused by high alert drugs, such as loss of drugs, dangerous abbreviation. C. Standards of sterile compounding preparations. And D. Standards of non sterile compounding preparations. The correct answer is A. The OSHA, stands for Occupational Safety and Health Administration, is a federal agency within the United States Department of Labor, and they're responsible for setting and enforcing workplace safety and health regulations. Next, which of the following abbreviation code is for before meals? AC, PC, PO, and CC. Correct answer is AC. AC means before meals, whereas PC is after meals. Next, a vial of chemotherapy doxorubicin is supplied to make 2 milligram per ml solution. So the vial contained 100 milligrams of powder. Patient was prescribed 50 milligram of the dose. Calculate the volume required to obtain prescribed dose. Like to get 50 milligram, how much volume have to be taken? Correct answer is 25 mils. So let's solve how to do it. So first step here is you have reconstitute. So 2 milligram per ml contain 100 milligram. That means you add 50 mils of diluent. So volume needed here is prescribed dose, which is 50 milligram, and 2 milligram per ml. That's the concentration. So therefore, you need 25 mils of reconstituted solution delivered 50 milligram of the dose. All right, stay tuned for pharmacy prep and subscribe pharmacy prep channel for more tricky and more must pass questions, and this helps you to prepare and pass your pharmacy board exams. Stay tuned. Until then, thank you and see you soon.